Cardiovascular Institute of San Diego, we are a one-stop shop cardiology clinic. Whatever cardiology needs our patients have, whether it is congestive heart failure, whether it's electrophysiology, whether it's interventional cardiology, structural cardiology, peripheral artery disease, venous disease, imaging cardiology, whatever cardiac need they have, they will not need to go anywhere else because we'll take care of all their cardiac needs. So if a patient has congestive heart failure, they have access to the electrophysiologist who's going to do their devices. They'll be taken care of at the Cardiovascular Institute of San Diego. We have clinic in South Bay, we have clinic in San Diego, we have clinic in El Cajon, in Escondido, and San Marcos. So we have the entire county covered.
We implant both single and dual chamber defibrillators, as well as biventricular internal cardiac defibrillators or cardiac resynchronization therapy devices. We implant subcutaneous defibrillators, which are defibrillators placed under the skin and do not have access into the vasculature. And then we also implant the Optimizer Smart device, which allows us to improve the symptoms of our patients and our heart failure patients.
Well, CCM, I think, is the new game changer in treatment of heart failure. Heart failure medications has been around for many decades and many years, and yet there are a percentage of patients that just don't get better or fail to improve or get hospitalized. And we feel like the CCM technology delivers a new modality that allows the heart to contract better, to allow them to relieve their symptoms, and more importantly, to improve and enhance their quality of life and prevent hospitalization.
The Optimizer Smart device is special because of the niche that it allows for the treatment of heart failure. This device allows us to go beyond just medical therapy, but not to the extreme degree of, say, something like a heart transplant.
Well, based on a European trial, there was a 62% reduction in heart failure hospitalization sustained up to 3 years. That is a huge benefit to our patients. I'm not aware of any medications or any devices that has provided this magnitude reduction when it comes to heart failure reduction. Despite the advances that we have heart failure, we continue to struggle with patients that have refractory symptoms, that have persistent symptoms that are not getting better. And our goal and our mission is that with this CCM implantation, we can provide that patients the quality of life they need to go on with the activities they enjoy doing every day.
We are very proud at Cardiovascular Institute of San Diego to be the first to bring this technology to the region of San Diego. This technology will have an enormous impact on the care of all heart failure patients.
This is a major stepping stone, a major innovation in treatment of patients with heart failure.
CCM therapy is indicated for patients from ejection fraction 25% to 45%. So these would include patients who are considered to have diastolic heart failure as well. So there may be patients with diastolic congestive heart failure where the ejection fractions are above 40%, but less than 45% who may be candidates for these therapies. But majority of our patients that we identify have systolic heart failure, meaning that they have a weak heart, who are appropriate candidates for CCM therapy.
And what we're looking for are those patients who, despite being on the best medical therapy that we have, things like ACE inhibitors, beta blockers, they remain with symptoms. They cannot go up a flight of stairs without becoming short of breath. This device is an option for them. The Optimizer Smart device is a minimally invasive device that we implant in our heart failure patients to help them feel better. It is a relatively short procedure and an outpatient procedure, and they recover very fast. The incision is a small incision, and it is subcutaneous only. A lot of patients will ask me that, "Doctor, is this like open heart surgery, or we're gonna have to crack my chest to put this device in?" And the answer is no, it's actually much simpler than that. This device is simply placed under the skin. All right, go ahead and turn on the device.
Okay, turning on the Optimizer device.
This allows us to deliver electrical impulses at certain periods of the heartbeat that allow for increased contractility of the heart. And in doing this, allows for our patients to feel better. It's unique in that way. In addition, it's special because of its simplicity. A lot of devices or a lot of implants that we have to do for patients for the heart can be very complicated and with a lot of risk. This device is very simple to implant. It's essentially the same as a pacemaker, which we've been implanting for decades. And so because of that, it has a very good safety profile. Our patients will go home. They don't want to move their arm in large movements for about a week, but they can do normal daily activities the same day, and they heal up very quickly within a matter of weeks and are back on their feet.
It's a game changer in the delivery therapy in our patients. Most of our patients become very frustrated with their lifestyle, and some of them have recurrent and repetitive hospital admissions that we can hopefully prevent, and more importantly, add more value in the quality of life they have that will allow them to do more and feel better and not get tired and exhausted by the complications of heart failure. CCM allows us to deliver that to our patients, and the impact is not a few months, few years. It's immediate. Within few days or few weeks, our patient will begin to feel better, experience improved lifestyle, have a better sense of well-being.
If you have any patient with any cardiac needs, whether it is coronary disease, whether they've had a history of heart attack, whether they have had a bypass, whether they have congestive heart failure, whether they have AFib, or cardiac rhythm abnormalities, whether they have really bad PAD such that they can't walk. Sometimes they may have really bad venous disease such that they have a lot of varicose veins and have a lot of pains and cramps, which is a quality of life issue for these patients as well. I recommend that you send these patients over to us so we can help take care of them with our multidisciplinary cardiology team to help these patients and intervene early to help treat their condition and prevent potential other conditions that may come downstream from having this primary cardiac condition.
There are thousands of patients in our community that still struggle with symptoms of heart failure. We have now great technology. We have a device now that we can actually implant our patients that will prevent them from being hospitalized, not just short or long term.
In the past, I haven't been able to tell my patients that a device that I'm going to implant in them is going to make them feel better. But now, with the Optimizer Smart device, I can tell patients that this device will make them feel better. And that's a great feeling to have.